Morning, EAKC. My name is Peter Kim. I'm a doctor of dental surgery, DDS. I've been practicing in Kern County for the last 25 years, 24 actually. Yeah. 9 years ago, I took over Dr. Robert Riggs' practice, and ever since then, I've been a member of EAKC. So I've been in EAKC with 9 years. I do general dentistry, so pretty much I do everything. Yeah. Anything that is beyond my scope will be specialty level or like complicated root canals, complicated extractions or surgeries. Those are I refer to the proper specialists. Anything with gum issues that is complicated, I refer to the periodontist. So there are specialty levels, specialists here in town that I work with, and pretty much we can handle every single problem. If it's not, then we send them, refer them to universities like UCLA, USC, UCSF. But that's it.
Good morning, everyone. Jennifer Tougas-Genova. I am the owner of Elite Aesthetics Dermatology. I've been a licensed medical professional for 19 years. The last 11 years, I've specialized in dermatology, and so that's all things dermatology, medical, surgical, and aesthetic derm. Opened my practice 3 years ago. Hope to see you guys on the 30th at our 3-year anniversary event. But we made it through to the 3rd year, so here's to hoping to many more. Thank you to everybody that's been in support of us too.
Hi, good morning. I'm Debbie Hankins. I'm currently the CEO of the Foundation for Medical Care and Health Edge. We're a third-party administrator handling self-funded health plans for employers, working with brokers. My background is I'm a critical care nurse by trade. I've been a nurse for 37 years. I worked at Adventist Health for 25 years and did a variety of roles. I was director of critical care. I also was, I left there after I was the chief nursing officer for 7 years. I came over to the foundation as COO, and I've been the CEO here for about 4 years. So, looking forward to talking to you about what your questions you guys have.
Good morning, everybody. I'm Dr. Hugh Beatty. I call myself the wellness doc because I want people to be well. Some of you might not know I'm board certified in anesthesiology because people always ask what are you board certified in. But what I practice now, there's really no boards for. They're trying to come out with a board certification that's recognized by the American board system, but right now it's not really considered on the same level of the traditional medical boards. I practice functional medicine. Functional medicine, people ask me about that all the time. And unfortunately, influencers and so many people have invaded our wellness space. And so I constantly get people calling. In fact, someone called me last night and was saying, "Hey, doc, before I go and get this testosterone and peptides from these guys at the gym, I want to give you a shot." And so I'm thinking to myself that the first rule of thumb is to do no harm. And so I'm still a physician, and so my first focus is to do no harm. And I'm constantly trying to figure out and learn new things that I can not only do to help the patient, but also what is legal. Peptides are still not legal in California if you inject them. I guess you can get away with it if you're not a licensed physician, but if you're concerned about your health, you really think about that. The person that called me last night wanted to start testosterone in his mid-30s, and so I just ran a couple of things down to him, what he should be concerned about testosterone in mid-30s. 1, do you really need it? 2, what is the long-term effects? 3, you can become infertile from it. There is a clot risk so far as stroke and heart attacks from that. You can increase your estrogen, get man boobs, if you want to call that, and increase cancer. Estrogen causes cancer. So if you're not being monitored, you're doing a lot of harm to yourself. So as a physician, I first think about do no harm. So that's why I practice wellness.
Okay, so we're gonna open it up to questions. I have a question for Dr. Kim first. I remember when you spoke on this panel the last time, you were talking about the dangers of not having good dental hygiene as far as getting your teeth cleaned and stuff like that. The complications that you can have that don't have anything to do with your teeth. Can you talk about that for a second?
Yes, there's a correlation of heart disease, diabetes, and it's proven that it's related, it's connected with the oral disease. There's a bacteria that can cause problem for your gums, but also to your heart, and also create problem with diabetes. Uh, the percentage, if I'm correct, I think is related close to 60%. So, one thing that we can uh, defend ourselves, first line defense is to see a hygienist every 4 to 6 months for proper cleaning, remove all those plaque buildups that grow underneath your gums, and they can also help prevent heart diseases and diabetes.
Yeah,
Yes.
I was listening to a podcast about it, and they were saying like 80% of heart disease is detected through dental hygiene or whatever, and the person was saying that they don't ever get their teeth cleaned. Like, that is not okay. It's that they're like, but I brush my teeth every day, and I'm like, I feel like that's not enough.
Brushing your teeth, you've just only done half of it.
Yeah,
I think more than brushing, flossing and using proper tools, for example, like water pick, I think those are more important. I see more cavities these days due to the fact that we drink a lot of sugar products. There's not just sugar there, uh, but also acids, very acidic, yeah, almost to a point that they can burn, melt your enamel. So I do see a lot in kids with good physiques, athletes. They drink a lot of sugar products like
Energy
Monster energy drinks.
yeah, that's not a good
Yeah,
idea.
yeah. I don't see any energy in that drink. Yeah, yeah. More sugar and acids.
Yeah, those things are not good for your heart either.
Nope.
No. Anybody have any questions
I
of
have a
Tracy?
question. So
Yes.
are all toothbrushes created equal? Do you have a recommendation?
No, there are different type of toothbrushes. Each toothbrush is designed for proper patients. There are different type of toothbrushes: soft toothbrush, medium toothbrush, hard toothbrush. What we recommend for patient that has very strong arms, very strong muscles that can create erosion on the tooth, is because of the toothbrush. Yeah. In combination with the proper toothpaste. The, one of the ingredients in the toothpaste is pumice. And this pumice, some of these pumice that they use from dental companies, they use the ones that are soft and some of them is very sharp, rough. And those can cut your enamel and they can create an erosion and you wonder why my teeth is start getting sensitive. Yeah, it's probably because of the erosion causing your toothpaste, the pumice in your toothpaste and the toothbrush. So,
Brushing too hard?
and you're brushing too hard. There's such motion, stroke motion that proper stroke motion that the hygienist can teach you. So if you don't know the proper way of brushing, I highly recommend to ask question to your hygienist or your dentist how to brush properly. If you're start to get getting erosion. So the toothbrush that I recommend is soft for those that are doing too aggressively.
Big
Medium,
muscles?
yeah, with big muscles. Yeah. If you don't want to ask question and if you don't know how to do it properly, I recommend an electric toothbrush. The electric toothbrush is very highly effective these days. I personally use the electric ones. It's because it has the head of the toothbrush has a light, LED light. If you press too hard, it turns into red. If you press too soft, it turns white.
That sounds like a fancy toothbrush.
Yeah, and if you
You guys are
press
expensive too.
if you press enough between light and too hard, enough, just the proper pressure, it turns green. So you can see that, you can monitor if you're doing properly. And it has a auto timer that it gives you that beep every 30 seconds. So it beeps 3 times and then turns off automatically after 2 minutes. That's the amount of time that you need to spend on your brushing. And because it has a pressure sensitive sensor in it, you keep it going around for 2 minutes on a green light, you've done your job. Yeah.
Rick?
So are there different kinds of plaque? Because there's like plaque on your teeth, and then you hear about plaque in your arteries and stuff like that. Is that related?
Heart disease and plaque is bacteria. Yeah. And we found some of the bacteria is causing that heart problems. Yes. So it's related. Yeah. When it becomes systemic, it's related.
So it travels from your teeth to your heart?
Yes.
Scary. Real scary. Andy?
That's why they do prophylactic, used to do antibiotics for anybody that has a long-standing cardiac history
Yeah.
before their dental cleanings, because of that reason.
Interesting.
Yeah.
Hugh,
Yes, sir.
it seems like the fitness business goes fast all the time. And I've heard a lot about peptides the last few months. Never heard about them before. What the heck is a peptide? Oh my gosh.
Open it
GLP-1
up.
is a peptide.
We're gonna talk.
All right, well, I'm shocked that you haven't heard about peptides, because I started doing peptides in 2020 when it was allowed.
I'm slow.
And you were in BNI with me, and I talked about peptides.
I
You probably missed that morning meeting.
I'm sure.
But anyway, I got a
The
couple
word wasn't
videos on
familiar.
YouTube about it. But anyway, I'll just joke with you then. But peptides are just short chain amino acids. So it's a sequence of amino acids that are really what we call protein. But if it's shorter than 50 amino acids, it's peptide. Yes.
Pretend I'm a 5-year-old.
Yeah, that's what I'm doing. So when you start talking about, there's
Like, okay,
24,
pretend like I'm two.
there's 24
He did say
amino
man
acids.
boobs, not
okay?
gynecomastia.
Different amino acids make up what we call branch chain amino acids and peptides and then protein. Insulin is a peptide, but I can't remember how many amino acids in the sequence. So anything less than 50, at first it was 200 amino acids, we would call that a peptide, 200 or shorter. And then they changed it because there was a pharmaceutical company saw that these peptides are very effective in helping people. So they said, no, let's limit to 50 because get rid of a lot of potential drugs that they could sell. And so anything that's shorter than 50 is considered a peptide. So there's a lot of peptides out there. Right now that I know of, there's about at least, FDA looked at 19 of them. And RK Jr., along with Marty McCary, who's the head of the FDA, they're trying to get these things approved through the FDA. The problem is they've never really been studied for safety and effectiveness. And I kind of tell people, I want to be sure we're saying this, we did a big, massive study with the vaccines a couple of years ago, right? And so people are doing it right now with peptides. People are getting peptides from everywhere. There's Peptide Sciences, that company was just shut down recently. I think they may have been voluntarily shut down. It was March 16th. It was kind of interesting. I remember, I know the date because the patient was asking about it. He said, Doc, I want to get these peptides from Peptide Sciences. What do you think? I said, let's look it up. I'm not familiar with the company. And they had just got shut down the day before. And the thing is, they were a big source of peptides that were quote unquote not for human consumption. And it's kind of interesting. Patients will come and they don't want to take pharmaceutical meds, but they'll take something that's not even approved and not even been studied. I would rather that they take a statin than take something that's not for human consumption. And I'm not a fan of statins. Anyone's come to see me know that I'm not a big fan of taking any type of thing to lower cholesterol because it's essential. But yeah, there's a lot of benefit with peptides. In fact, I'm going to go to a course in Nashville in September because I'm hoping that things will open up for peptides. I do know a lot about peptides, but you can never assume that you know everything. Because patients are out there, they hit me with stuff like, what about the Wolverine stack, the MOTS-C? They want to know all these different things. One of the things is NAD is not a peptide, so that actually is a coenzyme, comes from vitamin C. So hopefully I answered your question.
Okay,
Yeah,
well, what are they supposed to do? What is their?
heal the body. Heal the body, in the sense that, well, look at it from this perspective, like there's glutathione. Glutathione's a peptide, it's made of only 3 amino acids. And it actually can reverse organ failure. I use glutathione all the time right now in patients who have decreasing kidney function. In fact, one of the nephrologists in town, he's just amazed that several patients that I've had with him have reversed their falling GFR. They were getting down to the 30s, they're back down high 50s or low 60s. And it was only because of the NAD and the glutathione. So if you look at what happens when people take too much Tylenol and they get liver failure, it's because glutathione levels are drastically falling. And if you have low glutathione level, you are really at risk of organ failure, whether it's liver, kidneys. And so when I see people with decreasing organ function, I give them glutathione, which is a peptide. It's made up of 3, glutamine, cysteine, and glycine. Yes, sir.
Yeah, by the way, Andy, if you ask your 5-year-old, he'll probably know all this stuff. So the question I have is, I hear cases where a person doesn't have high cholesterol, but they've been told that the cholesterol particles they have are the wrong size.
Yes.
So they say, either you have large ones, you need more small ones, or small ones, you need more large ones. I can't remember what they say. But they put them on statins anyway. Can you comment on that and what's going on there?
Yeah, 99% of doctors in the United States are traditional doctors, so they will put you on statins. But functional medicine doctors, we don't start there. We say, well, why is your cholesterol high? And you're talking about lipo-A and lipo-B, which is the small particles. Those are the ones that get behind what we call the blood vessel lining, the intima, and they create this inflammatory response called foam cells, and they get hardening of the arteries with calcium. But the key to that is this inflammation. All that starts because of inflammation. And as what Dr. Kim was saying, inflammation starts in the mouth. That's why I have the same mouth, from your mouth to your blood, how healthy is your gut. So if you're inflamed in that mouth and gut area, then you are prone to inflammation in the blood vessels. Once you start that cascade, your cholesterol is there is a powerful antioxidant. It's trying to heal the body. So it's doing its part. So the things that I tell patients that don't get concerned about the cholesterol, one, we're gonna work on wide side and try to get it down by getting you healthy. But the main thing, do you have insulin resistance? Do you have high C-reactive protein, which is inflammation? If you have normal CRP and you have normal insulin levels fasting, then you shouldn't be concerned about the cholesterol number. So I see too many patients who are on statins and they do the opposite in the blood vessels. Statins lower vitamin K2, and vitamin K2 takes the calcium out of your blood vessels and sends it to the bones where it should be. And also, statins lower CoQ10, which is essential for the heart. Statins, there's studies that show that statins are actually linked to heart failure, dementia, diabetes, and cancer. So it's not a safe drug. So I have cardiologist friends, we respect each other, but they know when they see my patient, they tread a little lightly about giving them statins because they know I'm working on getting their cholesterol under control by getting their inflammation and their insulin resistance under control.
Well, okay, so what is the number on cholesterol that you don't need to take those statins?
Well, none of my patients take statins. I don't focus on the cholesterol number. There's so much information starting to come out now that 240 is actually a good total cholesterol number for brain health. 100% of myelin is made up of cholesterol, and myelin is 75% of the brain. So your brain needs cholesterol. One thing about the statin drugs can't cross the blood-brain barrier, which is good, and most of the cholesterol is made in the brain anyway. Every organ in your body makes cholesterol. I mean, all the cells in your body can make cholesterol, but the main source is liver. 80% of cholesterol is made in the liver. Eating dietary cholesterol doesn't affect you, so don't be concerned about that, because it really can't even get absorbed through the gut. It's too big of a molecule. So most of the cholesterol is coming from the liver. And the thing is, though, that's interesting is that the mitochondria needs cholesterol. You can't make ATP without cholesterol. You can't make sex hormones, testosterone, estrogen, progesterone without cholesterol. You can't make vitamin D without cholesterol or bile salts without cholesterol. So the most important thing we need is cholesterol. It is the father hormone, and we're just attacking it like it's not important. When I was in med school in 85, I'll make this real quick, Jennifer. When I was in med school when I graduated in 85, we didn't even talk about cholesterol. I never heard of it in med school because the drugs for lowering cholesterol came out in 84. Okay? So I was basically done in med school by the time they came out with drugs to lower cholesterol. And then in 85, they came out with the guidelines. So.
I just wanted you to touch more upon the demyelination of the brain with dementia, aphasia, even now that we're seeing. And based off of the American Heart Association guidelines, you don't even have to have elevated cholesterol. They will recommend that you go on a statin if you've had high blood pressure times 2 readings. So the long-term effects of it, this is what we're seeing. So I just wanted to touch upon that. I'm dermatology now, by the way, but I was nice to you before.
No, it sounded like you did a great job already. But yeah, that is concerned because I just saw the last guidelines from the American Heart Association by saying that they want now to push the LDL down to below 50. And the total cholesterol they wanted, I can't remember the exact number, but I just think this is scary. I haven't seen anybody on a statin that did not have some kind of problem. Either muscle pain, if you look it up, statins are known to kill the mitochondria in the muscles called myopathy. It negatively affects the heart. I was one day with a patient, I was looking up cells, because cells have different lifespans. The heart cells have to last 40 years. So I get these patients who are coming to me and they have degeneration going on throughout their whole body. And degeneration is not just an arthritic term like in the joints. It's also the cells. The cells get degenerated. So I'm talking to him about the heart cells because he's having a lot of arrhythmias. He's really concerned. They just put an implantable pacemaker defibrillator. And he was really concerned. He said, Doc, I think I'm gonna die. He's in his early 40s. And the cardiologist saying, well, there's not much we can do. And I'm like, there's a lot that you haven't tried. You know, your body responds to oxygen called ozone. So if you look it up, in fact, they were trying to get IV ozone approved for heart failure. There's a lot of benefits. If you have a heart attack, get that IV ozone as soon as you can. In addition to that, what else benefits the heart is NAD. NAD is considered a vitamin B. It helps you make ATP. So I started doing NAD on him. Selenium. Selenium deficiency is linked to heart failure. And people who have low selenium levels can have atrial fibrillation and heart failure. So we started doing those things, and his cardiologist was amazed. He started having less events. He was going in these little short runs of EAKC and had to get shocked by his implantable defibrillator. And so he started feeling better. He actually returned back to work. But those are the kind of patients I love. That's why, look, no one's helping you. If I don't help you, I'm not any worse than these other physicians. But the bottom line is there's so much that's out there you can do if you just look for it. The patients are doing their research. They're coming in there. They say, Doc, you're the first doctor I ever had that I can sit down and have a discussion with. Because the general physician you go to, you want to talk about vitamin D, they'll tell you, well, you get it from your food. No, vitamin D comes from the sun. Mm-hmm. But they'll say, oh, you don't need to take extra vitamins. Don't be so concerned about your diet. You know, go out there and take a walk after a meal. These are minimal standards. And if someone really wants to be fit and well, you can't even talk to that person if you're doing traditional medicine. That was my
I have a question for you about NAD. Is NAD like it's all the same no matter where you go or how you get it, or is like ibuprofen or whatever, you know?
Well, NAD, nicotinamide adenine dinucleotide is what it stands for. And the preferred method to provide is IV, I believe, because it's a molecule you can't absorb through the gut. That's why people are recommended NMN and NR, I think it's nicotinamide ribosome. And those two can get in and be precursors to NAD. So if you're gonna get it done, I believe they should be done IV or injectable. Some patients are getting doctors to inject them like an IM injection. I do it every year. I do at least 8 infusions a year. I did 4 earlier this year, and I plan to do another 4 in the fall. But this is the fountain of youth. You feel great. I mean, it helps heal the cells. So why wouldn't you want to do it?
But so you can go anywhere and do it, whether you're doing it with you or another doctor, it's the same kind of thing. Whether
Yeah, but be careful the source, where it's coming from. If your guy in the gym wants to give it to you, where did he get that from? I have to get it from reputable places.
Wondering if it's the same challenge as the peptides or whatever, you know, where the peptides are people are coming out of the woodworks doing peptides and, you know,
Yeah, NAD is not a
Okay.
peptide, so it doesn't have.
so it's not the same thing, okay.
Can I piggyback on the nicotinamide?
Yeah.
So I'm not sure if everybody's aware, but nicotinamide, there's evidence-based studies, just taking 1 gram a day can decrease your precancers by 11%, decrease squamous cell skin cancer, which is caused by the sun, most common in our county here, by 30%, and decrease basal cell by 20%. So the literature's out there, it's been out there for over 10 years now. So just taking something over the counter every single day, no side effects, no contraindications, can decrease your risk of skin cancer significantly.
And what is that? That's a,
Nicotinamide.
And it's
and is it a?
It's
pill?
oral. It's
Okay.
it's an oral over the counter. 1 gram is what you would take daily. No, it's not nicotine. Doc, you want to explain that?
Well,
It's anti.
well, nicotine is good, actually.
Yeah.
You take it, it's good for stimulate. It's at the neuromuscular junction, it's a transmitter.
low
And
levels, right?
yeah, low levels. One of my patients came in once and said, "Doc, try this nicotine gum." And I got such a buzz from it. And it was too strong for me. But I have patients who are wearing nicotine patches, they're doing nicotine gum.
They cut them, the nicotine patches, cut them, even
Yeah.
a small dose into like 4s, and just wear a fourth of a nicotine patch. I mean, some people believe it cures like long COVID, and you could probably talk
Oh,
way
yeah.
more than I can on this.
Oh, yeah, the nicotine receptor is important in virology and virus. The thing is though, is that, you can't overdose on the nicotine. You can get too stimulated though. At the muscular, what they call the muscarinic junction, that's where the parasympathetic and the sympathetic is involved. So if you take too much, you might find that you stimulate your gut to have bowel movements or your heart rate might slow down, stuff like that. But in general, nicotine is very safe. The thing that's interesting, patients might say is having a hard time finding nicotine patches. They're trying to remove it from over the counter. It's interesting. So.
Interesting. Tracy?
I want to hear from Debbie.
You know, I have to say, working in the hospital, it's full of very interesting stories and exciting things, and the business that I'm in right now is just not that interesting compared. And I could talk about saving your life. Anyway, I think probably the biggest thing that I'm dealing with right now is, you know, I worked in the hospital for 25 years, and I thought I knew everything about healthcare that there was to know. I was a chief nursing officer, ran all kinds of units, and what I found out when I went to this side of the business is there's a whole slew of things that go on to get providers paid, to understand how your health plan works. I probably would venture to say that most of you don't even look at your health plan. You don't even know what you've chosen. You don't even pay attention to it. And I have to say, if I could encourage you to really look at your health plan. For example, let me just tell you, I've never been sick a day in my life. I literally didn't even have a cold for 30 years. So I bought the cheapest health plan at my employer. You know, I bought the total out of pocket for the year was $8,000, okay? And never even gave it a thought. And then I wound up with cancer a few years back, and it happened in November. And so, of course, I was on chemo, and I literally had to pay $8,000 for that in November, and had to turn around and do it in January again. But I bought a buy-up plan. And so I encourage you to take a look. Matter of fact, I wrote an article called Benefit Basics. It's on LinkedIn and other social media, and it goes through and explains exactly what your health plan is and what it does. Like, what is out of pocket? What is my deductible? You know, people, when they get their bills from their physicians and hospitals, they flip out and go, "Oh my God, it's $50,000. What they don't realize is that don't pay that bill. What you do is you wait until you get what's called the EOB, explanation of benefits. You can get them off the internet. Off of the like your health plan website, or you can, or they come in the mail. And to take a look at that, because if you have insurance, that insurance company, that network, they have contracts with your doctors, and so if the bill's 50,000, they allow 20,000, or they allow 20,000. They'll pay that, and the doctor has to write off the rest. So you don't pay what you think you pay. So don't pay it until you get that explanation of benefits and it'll match up with your bill. Be careful about that. And that's one thing I learned. I have, friends that are CEOs and other, like nurses. They don't know. I had a friend call me just the other day. She's a COO at a hospital here in town. And she got some information about a bill and she's like, help me. I don't know what's going on here. Why is the doctor charging me for anesthesia? She had surgery recently and she was in a hospital and she doesn't get to pick her anesthesiologist. And they said, sorry, we're not covering this because the doctor's out of network. And she's like, help me. So she doesn't have to pay that. There's a whole government thing that says you can't do that. The doctor cannot charge you even if they're out of network. So if they work like in a hospital. So I just encourage you to pay attention. And when you choose your health plan, be careful because you don't, what is your needs? And as you come on your open enrollments, and I'm sure these folks here that are here for guests will tell you the same thing. It's not just about the money that you pay monthly out of your check. It's about what if you do get sick? What if someone in your family gets sick? How are you covered in your benefits? So I have to say, I'm certainly here to help you take a look at that. And I'm sure you guys all have other colleagues that are. But that's the biggest thing. And people that you think are in healthcare, like nurses, doctors, that sort of thing, a lot of times they don't really understand exactly how health benefit plans work. People say, I pay my premium. Why can I not get covered? Because that's not a benefit of your plan. And so, anyway, there's like good resources out there. Like I wrote the article, take a look at
I was
it.
gonna say, how can we get that article?
It's on LinkedIn, or I'll send it to
Maybe
Kathy.
Kathy.
She can send it out.
That would be
Because I
great.
thought, here's the top 10 things, how to choose a health plan. What happens when you get your bill? Here's some major some simple terms, and become knowledgeable. Because the older I've gotten, the more I realize, because I got nailed on my own health plan. I know what that feels like. And I just chose poorly. I wasn't thinking. So, anyway.
I have a question.
Uh-huh.
So I'm self-employed and my daughter and I both have a hereditary anemia. And I just get wiped out with my healthcare plans. I mean, they're just astronomical.
Yeah.
And is there a better way to do that? Is there groups you can join to get to a group coverage or, it takes a big chunk out of our annual income.
It really does, because people don't realize too that, let's say I'm 64, turned 65 this month. My employer, for my health plan, my premium a month was $1,400, okay? My employer happened to cover 800 or 80% of that premium, but I did the buy-up plan, so I was paying quite a bit a month. But people don't realize, and they go on COBRA for some reason, and they're like, what do you mean I was paying $80 a paycheck or $100 a paycheck? That was my premium. No, your premium was $1,400 if you're my age. All premiums, especially if you're small group, they're called age banded. And so for someone that's 30, their premium maybe, I don't know, you guys could tell me, $600 a month. And someone my age, it'll be $1,400 a month. And so employers, that's another thing. Employers get, if you have an aging population that works for you, you can get nailed on the premiums. I know my company, we have like 7 or 8 people that are over 65. And so our costs were going astronomical. We actually instituted something new in our company that we do premium reimbursement for those of Medicare age. So actually, I spend $500 on a month for someone that's on Medicare, and I was paying like $1,200 a month for them on the premium for my health plan, and the coverage is better. So, I mean, there's so many nuances, and I mean, it took me a long time to figure everything out, because again, I thought I knew everything about healthcare, and I thought this whole thing on this side of the business, I really was uneducated about. I certainly didn't learn it in nursing school, or even being an executive for, 10 years. It was something I knew pieces of, but it's a second expense for an employer behind labor. Your paychecks that you're paying your employees is your coverage for your health plans, and it can be astronomical. And to answer your question, there are some options that you can have. You certainly, there's brokers here too, but there's all kinds of different ways that you could set up your health plan to where it could be more beneficial for you financially. We can talk outside of that.
What do you think of the health savings accounts?
I think they're a good option. As a matter of fact, one thing my company is working on right now from this group, because I've had a lot of questions about small employers, and we work my customer's truly a broker. And so and I have brokers asking me, what are you doing for small group? Because we have like CIS, self-insured schools, or the county of Kern, big, large groups for medical. We do small group dental and vision. But the health savings account, what we like to do, what I'm working on right now, is you have a high deductible plan. It's fully insured because when you're a small group, small. And so your total out of pocket might be, let's say, 10 grand. And then the employer self-funds the front end through a health savings account or a health or HRA, similar. There's some differences. And then the employee just looks at it and it looks like a regular PPO plan to them. There's a card that you could have or reimbursement set up, but they're actually really good. If you're not sick, especially, you could just keep throwing money in your HSA, and your employer often puts money in that as well. And then if you do get sick, you can use that money for your expenses. And even if you have a high deductible, let's say it is $7,000 or $8,000, you can use that money that's been sitting in your account to pay your expenses.
Even your specialists too.
Absolutely.
Because they use it
Special.
often.
And there's also, all kinds of different things, not just the doctor, it's whatever your expenses are. It works really well. But it depends on what your needs are. If you're sick, it's probably not the best idea to have, one of those high deductible plans. But you never know when you're gonna get sick.
Excuse me, can I ask you a question? I want to know this. More and more of my patients are frustrated that nothing's covered, and they're paying a lot monthly, and they're saying, well, doc, I didn't know that this wasn't covered. And even now, I'm trying to get MRIs approved for people who actually need MRIs. And so how do you handle those kind of questions?
In my experience, a lot of the time when things, if they're covered, people need to look at their benefit. Everybody, you probably haven't even seen, it's probably in the packet that you never opened, is when you get your cards every year for your health plan, there's something called the summary of benefits. And when you choose your health plan, I highly encourage you to look at your options and read the summary of benefits. It'll tell you what's covered and what's not. Your MRIs, your CAT scans covered at 80%, of allowable. I mean, there's all these different things that they're covered. But I have to say, no offense, but most of the time when something is covered and then it gets denied, it's because the doctor did not document it appropriately for coverage. There's very specific things that in your summary of benefits that says it's covered under these conditions. And oftentimes, I'll say, you need to call your doctor. I mean, I can't tell the doctor what to write, what to say on the report, but and they get pretty routine to get it covered if it's allowed. And a lot of times the doctor, they won't even do an MRI until they check they have their staff call, like our office, we have a third-party administrator, and they'll say, what's the coverage? And we'll say, it's covered at this, under these conditions.
I think that's Jennifer's specialty.
Yeah, absolutely.
Knowing what to put it under, I've had a conversation with you about that.
It's not like you're trying to scam the system. It's like you have a patient that has a need for an MRI or a CAT scan, and it's like writing the appropriate verbiage to get it covered. It's kind of an art. It
Also,
really is.
it's a lot of individualization. So we are doing a lot of extra legwork. We're contacting your insurance companies. We're getting prior authorizations. It's a lot of work. And half of the time you contact these insurance companies and they're just going off of an algorithm. They don't understand anything about diagnostics. And then they'll tell us, you have to try and fail this. Well, this is a fungal condition, and you're telling me I have to put a topical steroid on this? No, I'm not going to give ketoconazole when I need betamethasone. So a lot of times it's really just fighting the insurance companies and
That's true.
yeah.
But really, go ahead.
They're saying they don't understand those words that you just said.
Oh, one's an antifungal and one's a topical steroid cream.
Okay, Tracy.
Okay, I want to know what is, for the ladies, what is the newest, greatest thing to make us look good?
Okay. Well, so I would say there's a lot of things because it's multiple modality, but honestly, old school CO2 fractional laser, it's like buzzing back. I was running that Fraxel laser 11 years ago.
Does it still hurt as bad as it did?
No, actually. And now we have like Pronox laughing gas, which helps a lot. And then the healing time completely. Our technology is so advanced now. It's great. The old school Fraxel lasers that we would use, I mean, you would be down for like over a week to 10 days.
It felt like somebody was running a hot poker over your
Yeah,
face.
I had the old school one done. Yeah, and then the new one that we have is just amazing how far technology has come. I would say better results too. Less downtime, better results. About 7 days. Yeah, 5 to 7. It depends. Everybody's downtime is different. Like I'll go out looking like I have a sunburn on my face after, you know.
Swell.
Yeah.
People get a lot of
Nope,
swelling.
nope, the swelling is minimal now. Yeah, I just feel like the technology has come so far. We're very advanced. But definitely multiple modalities. Skincare is everything. I mean, you know, your skin is your largest organ of your body. You have to take care of it. Drink a lot of water, hydration, but moisturizing too. If you're looking more for like the anti-aging, but you know, even like pre-cancers, a retinol or retinoid. So tretinoin is old school. You can get that prescribed by most of your providers, including us. It does a great job with that, but it helps with fine lines, wrinkles, brown spots, texture irregularity, acne. I mean, the list goes on. Everybody should be on tretinoin in my eyes. So
What's the best thing for your neck?
neck. So neck is a very delicate area, of course. So if you can get your retinol on there and you can tolerate it, but we have, you know, some really good, you know, medical grade skincare and the CO2 laser, microneedling. I mean, there's so many different things. It just depends how hard you want to go, or if you want something that's going to be, you know, a little bit more work, and you'll see the benefits of it long term, like 6 months to a year down the road. I'm kind of instant gratification, so I'm going to do everything that I can. CO2 all the way.
Can I make a comment about that? I know that you're the star of all the skin stuff, but what I found over the years is that when you heal the inside of the body, the skin even looks better.
Uh-huh.
When you do all that ozone and NAD, get them on the hormones and vitamins and minerals, boy, then send them to Jennifer, probably look amazing.
Diet has a lot to do with things, especially autoimmune disorder. People don't realize, you know, yeah, your gut health is connected to everything. So inflammation a lot of times is caused by what we put in our bodies. And going low gluten or gluten free, I'm able to take some of my patients off of like these, you know, immunosuppressive medications that have psoriasis and control their psoriasis at the same time with diet. Obviously, it's not just diet. There's a lot of things functionally that you need to include, but diet alone can help a lot with that. We know sugar is poison. I mean, honestly, sorry, it is, guys. And inflammation is caused by it. I mean, ask our dentist over here. He'll tell you, no sugar, right?
Nope.
Nope, we don't like it.
All right, want to talk, oh, Tim, real
Just,
quick.
we're looking at, I'm a Costco user, right?
Mhm.
So in the back there, they have all their vitamins and minerals. I mean, it's a smorgasbord. And I do take a few of them, fish oil and a multivitamin, vitamin D, and a niacinamide.
Mhm.
But what do you think about those things? Like, my fingernails are horrible. I see there's one for fingernails. You know, what do I do? How much do you pay attention to those things?
Well, I always believe that you need to test first, see where you are. So test instead of guess. And so there's a hand scan I do when a patient comes to me for the first time. I'll just scan their hand, see where the minerals are, the vitamins are, the nutrients, any heavy metals, and then you just monitor. Patients do say that, hey doc, what's the preferred brand? I said, well, it depends on how much money you want to spend. There's some brands that are a lot more pure, but then you never know what you really are getting anyway. So I have patients do the Costco brands, they do the Amazon brands, and I check their levels and they do come up. It just depends on what's in it. I have more confidence with what's in those vitamins than what people are getting these peptides from.
Okay.
I like that little saying he said. Ours is, when in doubt, cut it out. So if you come to me and we see something that's suspicious, I mean, of course, now we have a tool called dermoscopy, which is amazing because there's so much you can't see with the naked eye. And it's groundbreaking. So every dermatology provider should be trained in it. You should be doing your continuing education in it. 10 times polarized magnification. You can see so much more with it. So let's not blindly biopsy anymore. We can even tell levels of atypia just from a mole. I can say that one's just mild. We don't do anything per guidelines, or this one's mild to moderate, same, or this one's severe. It's the last step before melanoma. It's coming off today. And that can all be done with our tool. It's like going to a cardiologist or a pulmonologist and they don't have a stethoscope. So that's our tool in dermatology.
Okay, so just so everyone knows, if you have any questions and if you didn't learn anything, Andy, if it wasn't sinking in,
Andy, we're gonna quiz you next.
I'm just saying, you have the experts here, just see Dr. Beatty, see Jennifer like you, see Dr. Kim like you have the experts up here to do the homework for you and to get you healthy from the inside out. So thank you guys very much.
Thank
I want
you.
to say one last thing, Jen, about your anniversary party.
Yes.
So let's remind everybody, April 30th.
April 30th, noon to 7 p.m. Please join us. It's going to be a great day. 3 years in the making. Chef Lino will be there catering the event. And he has a dessert board too that he's bringing. So we have servers. We have a lot of local vendors, small business owners as well. Sip and Swirl will be there. Frozen margaritas, frozen lemonade for the kiddies or the ones that don't drink. And
You also have specials and stuff that you
yes,
can
oh sorry,
at
yeah.
times.
Most importantly,
That's
yeah.
what
So
everyone wants to know.
we have 20% off gift cards. We'll be doing a few raffles, but we'll be raffling off a year of Botox for free. We have a $4,000 gift basket that has like facials, products, things like that in it. And then those proceeds, 100% of it goes to our local chapter of the Leukemia and Lymphoma Society. I'm a board member of that, so.
Okay, perfect. Thank you guys very much, everybody.